जलधि तरंगा तब शुभ नामे जागे तब शुभ आशीष मांगे गाहे तब जय गाथा जन जन मंगल दायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे।
Honorable Governor of Telangana and Honorable Lieutenant Governor of Puducherry, Dr. Srimati Tamilisai Soundarajanji, Dr. Yugandhar, Chief Executive, C.R. Rao, Advanced Institute of Mathematics and Statistics and Computer Sciences, University of Hyderabad Campus, Hyderabad, and Indian Statistical Service, Probationers of batch 2021 and 2022, total 58 members are there. And now there will be exciting interaction with our Honorable Governor. As you know, she is a medical postgraduate and she is a gynecologist. Now handling 2 states with ease. She works for in a day she works almost for 18 to 20 hours. She hardly sleeps for 4 hours or so. And in that also she completes 48 hours of work in just 1 day only. That is her capacity. So now your interaction will be very exciting. Our program will be like this. Dr. Yugandhar will brief about the training program held here from May 15 to June 9 for these probationers, and after that Ms. Navdeep will speak about her program details here at Hyderabad, and after that Honorable Governor will give her message. Then you can interact freely with Honorable Governor. She will definitely guide you in all your future endeavors and career. Thank you. Now I request Dr. Yugandhar to speak about the program.
Good evening, Honorable Governor of Telangana and Honorable Lieutenant Governor of Pondicherry and staff of Rajbhavan. And it's really exciting, as he said, and we are honored, madam, that you have given appointment to the youngsters, and you will be giving the message that will go a long way in their career. And it is the 43rd and 44th batch of Indian Statistical Service. The institute is named after a legend, living legend, Professor C.R. Rao, who is 103-year-old. He got a highest award in statistics in recently, equal to Nobel Prize. Although he will not be able to receive, his daughter Teja Rao will go into Ottawa in July, $65,000 she will be receiving shortly. And we are executing projects for Government of India, madam. NSCS, National Security Council Secretariat, under NSA, Ajit Dawsa. And for outside world, it is simple mathematical and statistical institute and computer science institute. And we are working for RAW, IB, NTRO. NTRO is nothing but technical intelligence of PMO. And our predecessor, Narasimhan Sir, was a user of the technology as a director IB. He used to visit us and encourage us better. I also requested Honorable Governor to visit us. Because of COVID, she couldn't make it. And she promised, I request the ADC staff to kindly slot one listening to us. And as far as this batch is concerned, earlier, madam, we used to get a small number. And this is 2 batches combined. And they have gone to plethora of institutes. And we even trained secretary level, DG level officers also in the frontier areas like machine learning and artificial intelligence. And they have undergone training in premier institutes like Indian Institute of Management, Lucknow, FSI, Dehradun, IEG, Delhi University, IGIDR, Mumbai, College of Agricultural Banking, Pune, Jayatee NIFM, Hyderabad, MCHRD Institute of Telangana, ASCII, Hyderabad. So in our institute, they are there since 15th of May. They will be concluding on June 9th on artificial intelligence, big data, data warehousing and machine learning. It is a tool for them and it's a very versatile service. Even after their retirement also, they stay connected to the subject and you will be interested to know some of them are doing PhDs and they are interested to do PhD with our Indian Institute and we are trying to this thing and many people doesn't know that there is a service called Indian Statistical Service. It is a highly intellectual and they based in all over the ministries and I request Honorable Governor to recommend the Government of India to depute some of them to the state government so that the planned document has to be prepared by these professionals. Normally, you hardly find ISS officers in the state. So they think that Government of India is a premier place. But even if they want to come also, state government should allow because it's a highly professional job and a highly intellectual job. Not like IAS, IPS, they will have tensions 24 hours. They will be sitting in Yojana Bhavan, they will be sitting in Ministry of Industries, they will be preparing the plan document. At the stroke of office hours, they can complete and they can hand over this thing and they can resume the next day. That is the job provided. But the data is very, very important to all the ministries, whether it's a civil aviation, defense, or planning, or medical, and our colleague now will brief about all these things. And now I request participants to interact with the governor after that, or now the speaks about. With this viewers, I once again thank you for giving this nice opportunity. I once again request you to visit our institute to see our facility. A nice ecosystem, good R&D system is there. So once again, thank you. Thank you, sir.
Now I request Ms. Navdeep to brief about her training and service.
Honorable Governor of Telangana and Lieutenant Governor of Puducherry, Tamil Sai Sundararajan, all the dignitaries present over here, and my dear colleagues, a very good evening to all of you. I am Navdeep Kaur, 2021 Batch Officer Training of Indian Statistical Service. It is a matter of great pride and privilege, ma'am, to have got an opportunity to speak in front of you. Talking about the discipline of statistics, the history of statistics in India dates back to ancient times, with the collection and analysis of numerical data being an integral part in various fields. Statistical techniques are employed in ancient India for many purposes such as governance, astronomy and agriculture. The Arthashastra, which was written by Kautilya around 4th century BC, describes the importance of collecting and analyzing data for effective governance and taxation. The formal establishment of statistical organizations in India began during the British colonial era. The Indian Statistical Institute ISI Kolkata was established in 1931 by Prashant Chandra Mahalanobis, who is known as the father of statistics in India. ISI plays a crucial role in promoting statistical research, education and applications in India. After independence, the founding fathers of India, recognizing the significance of statistics in planning and administration, constituted Indian Statistical Service as a central Group A service on 1st November 1961 by a Gazette notification. Direct recruitment to the service was initiated in 1967 through examination via UPSC. The Ministry of Statistics and Program Implementation (MOSPI), after its formulation as an independent ministry in 1999, with the help of ISS, has pioneered in sample survey methodology, data-driven policy making, and advanced statistical analysis. The guidelines and operational details of Members of Parliament Local Area Development Scheme (MPLADS) are also determined by our ministry. During the COVID wave, rapid interpretation of epidemiological data proved to be critical for the development of effective containment, suppression and mitigation interventions. Currently, MOSPI is working towards building National Integrated Information Platform, which will act as a vehicle for official statistics, increasing automation in data collection, compilation, analysis, and dissemination. I am a part of the 43rd batch of ISS. We joined the service on 1st December 2021, and the 44th batch joined on 14th Feb 2022. We have undergone various training modules designed for better understanding of forest, labor, financial, agricultural, and industrial statistics, along with the courses on communication, leadership, management, economics, and energy from some of the best institutes of the nation. Currently, we are undergoing training at the Sierra Advanced Institute of Mathematics, Statistics, and Computer Science. Statistics is widely applied in diverse sectors in India, including agriculture, healthcare, economics, social sciences, and industry. Data-driven decision-making has gained prominence in governance. The Government of India has established national health information systems to collect, manage, and analyze healthcare data at various levels. These systems include platforms like Integrated Disease Surveillance Program (IDSP), Health Management Information System (HMIS), and National Health Portal (NHP). Vital statistics in India includes information on births, deaths, marriages, and other vital events. It is collected through the civil registration system and helps monitor population health, demographic trends, and mortality rates. Disease surveillance data is collected to monitor and track the occurrences of infectious diseases, epidemics, and public health emergencies. The IDSP is responsible for collecting and analyzing disease surveillance data from various sources, including hospitals, laboratories, and health workers. The government conducts national health surveys to gather comprehensive data on the various health indicators, risk factors, and healthcare utilization. Notable surveys include the National Family Health Survey (NFHS), District Level Household Survey (DLHS), and National Sample Survey (NSS). Also, India actively participates in international statistical collaborations and organizations. It is a member of the United Nations Statistical Commission and contributes to global efforts in statistical development and standardization. We aim to equip ourselves in the skill set and competencies required for becoming effective official statistician who contemplate to contribute towards nation building. I would like to extend my deepest gratitude to you, ma'am, for dedicating your time to meet with the officer trainees of Indian Statistical Service. Dhanyawad, Madam Governor.
Thank you, Ms. Navdeep. You have highlighted us about statistics and your statistical service. Thank you for all your enlightenment. Now I request Honorable Governor of Telangana and Honorable Lieutenant Governor of Puducherry to speak and to address the gathering.
A special good evening, each and everyone. My respects to Dr. Yugega, Chief Executive of the Dr. C.R. Rao Advanced Institute of Mathematics, Statistics and Computer Science. All the faculty members, scientists, dear officers, and all the other participants. Actually, whether you are excited, I am excited to see you all. Because such a fantastic section of our management, administration. During our childhood, to pronounce statistics itself is a very difficult thing. So pronunciation itself difficult. Then learning about it and exemplifying that is really a great job. Actually, I became a doctor. First of all, I love science. And another thing, I was unable to catch up with the mathematics. So I always feel that people who are all in statistics, mathematics are really super brilliant people. Because you have to be at it and you have to be very alert and you have to be very calculative. So whether in life or in administration or in academics, the people who are all calculating will be always successful. So you will be always calculating. So I'm very, very happy to meet you all. And what's your name? Navdeep. Ms. Navdeep has almost elaborated about your profession and your studies and your practical knowledge and you gave us has almost explained wherever what are the greatest institutions you have visited. I am always want to be practical, so I will talk because my talk I don't know whether what you like and what you want. So my talk will be very brief, and I will give some time for you to question, and I may also have some questions to you. And my first of all, I wish you all the best because you have selected a section of academics which is needed in all the departments. Generally, if a child passes +2, and when we ask her or he, they will tell, I want to become a doctor, I want to become an engineer or teacher. Nowadays they are telling, I want to become an actor, very rarely a politician. But they don't know the sections of academics which are there to help them, to help the society and to help the administration. So we have to have the awareness of the academics which are, as it is said, even the state governments are not aware of the services of your the expertise which you can complement to the administration. So when I was hearing about your presentation, Navdeep's presentation, I thought we are taking forward a lot of activities, but we are unable to complete. I always laud our wonderful Prime Minister, he is always scientific. For example, as a doctor, I really, after the pandemic 2 years, we were all suffering the dreadful disease. It's a pandemic and we were losing our family members, friends, just like flies, they were all dying. And after the invention of the vaccine, the way the data was preserved and the way the statistics were projected, every minute, if you tell that if it is 4 o'clock, at 4 o'clock how many vaccines we have completed, and what is the dose available, and what is the dose needed, and the data which was maintained, it really helped us. So, day to day, it's not before and all we used to do, we finish all the work and we will put it in the data, and sometimes it may be missed, and the reliability will not be there. But now, on the process itself, when we practice that, when we proceed with the activities itself, when we are good in our data and we are good in our statistics, during our work itself, in completion of it, because nowadays all the researches are based on statistics and data. And most of the time, even some of the administration, because I am in the direct administration with officers in the Union Territory of Puducherry. So when we want to take forward some of the schemes, so when we ask data, who are all the beneficiaries, who are all not beneficiaries, whether it is useful to them, who utilized the scheme properly and who wasted the scheme properly, and really it is needed, but they won't be able to tell the clear data. So sometimes a scheme, we will be thinking, oh, the scheme is very useful to them, but we don't know the data, how many are using it properly and to how many it reached. So keeping the data and the statistics is very, very important in the administration. So I want your help in one or whether it could be possible, I want to know. Because when I immediately became the governor of Telangana, immediately I took forward a very ambitious project, Connect the Chancellor, Alumni Connect the Chancellor. For example, when I visited the universities, I found some of the universities were lacking in the amenities, infrastructure, and some of the motivation. For example, if a student wants to go abroad for some scholarship, because I went to Canada on scholarship only, and I studied fetal therapy during my gynecology studies. So I have learned how this scholarship is very useful for the competent children. But when we wanted to know that somebody could help them, because government cannot provide assistance to everyone. So the particular alumni of that institution, and they can adopt 1 or 2 children, so that they are working in various parts of the world. So they can provide them with some of the assistance, whether whether it is books or stay or even payment of the fees, something they can. So with all these things, and when we found the alumni of all the colleges had alumni association, but the alumni, real number of the alumni will be lakhs and lakhs, but the numbers will be few thousands, sometimes few hundreds only. So I wanted I planned a very ambitious scheme of Chancellor Connect the Alumni, so that within 1 year we have to collect the data of all the old students of that institution, and we have to create a data statistics so that we can pick up the competent people and the eligible people who can help the students, because some of them are multimillionaires, some of the HR are very good HR, and some of them are running industries, and some of them are great academicians. So helping few children or contributing to the institution is not a very big thing for them. But in spite of we are going to complete 3rd year, but it's a great thought actually, because when we reach out to all the alumni, definitely there won't be any problem for that I used to say the past students connecting the present students. But we were unable to get the statistics. We were unable to means we are the correct path we were unable to travel. So my ambitious scheme is even in the half year. So my request is whether your institution can help us to reach out that data, alumni of each institution, so that it will be a great help for this generation, because the past generation helping the present generation. So instead of talking about the great things, and even today I read about our defense ministers talk in one of the institutions about statistics in the data and statistics in the defense. And in that also he has used a very apt phrase saying that don't imitate, always innovate. So sometimes technology means we have the tendency to imitate. So with great effort, one person will spend all his time and then he will invent one thing, and it's very easy to imitate. So always be innovative, don't imitate. That's a very good phrase which I found. And he also has said about how the data and phrases are very helpful. Data and statistics are very helpful in maintaining the defense security. And no section is devoid of data. I think nowadays when we are moving more advanced, and no section can be devoid of data. No section you will be placed in each and every department, or your need is there in each and every department. As it is said by Yugendra, it is if you want to be perfect, if you want to be very focused, and if you want a concrete plan, definitely data is needed. And medical, we no words to say, because what all the inventions and the statistics and the possibility of invention of drugs, and possibility of invention of procedures, and the possibility of invention of some of the drugs and allergies, everything based on the data and statistics. So even though and another thing which I may need your help is in the tribal affairs. We have adopted 6 villages and we are moving with them. But we don't have, even though the government has come up with some of the state so many Gondus, so many other groups, we are not very clear whether all the tribal assistants are reaching them, or really who are all the primitive tribals whom we have not reached at all, and whether the tribal assistance is reaching the correct persons. Otherwise there won't be, even now the child marriages are there, and even now the anemic deaths are there. So these 2 areas, whether you can help us with that, because your young, very active students are there. I don't know whether it is possible, but these are the 2 things which I wanted to ask you. so that whether it is possible to help us in our work. Now we can go with our, continue our question so that any other thing in the conclusion I can tell.
Sponsor a small project. So to utilize in the either ISS office or probationary ISS office. We can utilize the services for this tribal as well and data from the a small project.
Yeah.
So that we take it up with the secretary.
Yeah.
Yeah.
Yeah, but the office of mine joins with Ms. Bhavan Shankar and Raghu Prasad.
I will tell you.
They will communicate. So if it is quick and if it is, I always feel something because it has been dragging for 2 years. You may be able to help us within few months so that if it is so that.
From RBI.
Oh, okay.
That is the professional.
Okay. Yeah.
And then the proposal also can go from our company.
Yeah.
We will be the nodal agency.
Yeah.
And it is also exciting for them.
Yeah. So it's really great help for them. So help for us, not them. Because something innovative, something because even when I was a student of Madras Medical College, and when we had some problem in demolition of one of the very ancient heritage, that dissection center, and because we had the data immediately, we all went and then we were able to stop it. But there is no any data or statistics of certain things we wouldn't have done. So these are things which I feel that. Yeah. Yeah.
Will be the nodal agency.
Yeah. So that they can what to yeah. Okay, good. Continue your questions. You can give the mic. Who want to? Yeah. Introduce yourself.
So, good evening, Honorable Governor of Telangana and Honorable Lieutenant Governor of Pondicherry, and good evening all the dignity present here, my dear colleague. My name is Vishwanath Kumar. I belong to Indian Statistical Service of 2021 batch. In our terms, we call it 43rd batch. So, first of all, thank you so much for inviting us. You took out some time from your busy schedule. We are really privileged and honored to have you today. Thank you so much. Ma'am, today we are in the era of, as we know, the cutting edge technology where a lot of focus on the advanced technology and data also. You mentioned in the speech the importance of data. Even currently, all the governments are focusing on evidence-based policy. Still, our representation as a service, Indian Statistical Service, in the states is very, very less. We have a field operation division, FOD, where almost in each state we have one offices, regional offices as well as the sub-regional offices. But still our representation is very, very low here. So, on behalf of which I would request, and sir also, I would request you to, since you are heading to states, I request you to recommend, to have, the specialists like us in the state so that we can give more contribution towards the planning and the development of our country. So this is one of the requests which I have. And my one question I have, since you have a very vast knowledge and experience, and since we are entering into this prestigious service, we are going to start our service after this provision. What advice would you like to give for the new generation so that we can do well in our service and we can work for our country? Thank you.
First of all, I also think that the first your words should be carried out. And whenever in administration, when we ask, okay, we will carry out this, what's the data, what's the statistics, then immediately they won't be able to tell us. So really the productive scheme, if it should be, whether it is whatever may be, to reach out the people's statistics, and officers like you should help us. So it is a scientific method of approach. Everyone can do certain things. Before and all, when we were students, our teacher used to tell, the way medicine is advancing, there will be if a ENT specialist There will be ENT specialist for left ear and another ENT specialist for right ear. Right ear person cannot manage the left ear. So it's such things because it's a body only. So everyone should understand, as it is that IAS officer means okay, they can manage. Actually, it is we also think okay, we dump everything, okay, you do, and that branching out is very important. For example, gynecologists, before the gynecologists will look after delivery, gynecological procedures, operations, and preventive. But now, if it has been divided into fetal therapy, gynecologists won't manage the fetus, and fetus and the obstetrician would manage the gynecology. So these are branching out is needed as science advances, and the pattern of work also it needs so much perfection. So I am really surprised such a competency is not utilized in the state services. So I take this as an opportunity to introduce this type of expertise in the administration. So really I will take forward your message. And as youngsters, because you are all very clever students, you have selected a very unique branch of academics, and you are all very good in your studies, and because of that only we cannot be, you are all above average. So I should appreciate your presence here first of all. And as youngster, because I always feel when I entered the medical field, I always think whatever may be the situation, we have to exemplify in certain things. We cannot be an ordinary person. And it is, they used to ask me, you have become a governor in this younger age, are you an extraordinary person? I used to like very ordinary person. I like saris, I also like jimkis, flowers, like an ordinary person, ordinary women. But I do things in an extraordinary way. A small assignment is given. I used to think, no, it should be, we have to concentrate on it, and we have to put our mind and have total focus in that. So it should be little different from others. So this first, this type of mindset should be there. Second, we should always like our job. Whether we love this profession, this branch of academics before or not. Now we have entered this. So we have to start loving. Sometimes some doctors used to tell me, my students also, when we were there, no, I wanted to become an engineer. My father put me in medicine, so I don't want to study. So when we select immediately our total commitment should be in that. And I always say, enjoy and educate, love and learn. So when we educate, we have to enjoy and educate. And whatever we learn, love and learn. And we have to compete with the advancement. That is very important nowadays. Because during our days and all, one invention will be there in 6 months, 1 7 But nowadays, if we, because of this artificial intelligence and advancement in all the research and activities which you are focusing on that, see, within 6 hours we are ready. Before that 6 months we had one invention. Because 6 hours if we are not into the net for 1 day, we will be lagging behind our knowledge. So we have to compete with the advancement. That is very much needed. So learn new things. Technology means, okay, today I am able to use that technology to that level. So tomorrow what is that? So that will, our Honorable Prime Minister always says, when we were working in the party work, he always says technology will sharpen your skills. At the same time, reduce your time consumption. So if you are going on writing and making notes, just you keep it in a computer, and if you save it, time consumption. Because now we have to learn more, earn more. We have to utilize the time more. So you have to use the technology. You have to learn about the technology and advancements. And you have to be healthy also. I always, nowadays when I go to the colleges, I ask the students, raise your hand, how many of you do yoga, raise your hands. No, very minimal students raise their hands, very minimal number raise their hands. So you must be healthy. Health is very important. If you feel that, no, you may be an expert, you are a very great statistical person, you may be a very big academic, good academician, but a small headache will be shattering. So always be focused on your life habits. As the Honorable Prime Minister says, little lifestyle changes, small lifestyle changes can give great results to you. And apart from everything, don't compromise your happiness for anything. Life is for happiness, happy. So you are born to be happy. So whether you have any depression, whether you have any difference of opinion, whether you have any animosity or any challenges, it is there. It is life is there. It is not a smooth for anybody. Even the king will have some problem. Even the queen will be, the emperor will be have some problem. It is not that only. If you are born, actually one of the person asked, I am always worried. I want to see a person without any worry. The saint took him to the burial ground. Here is the person who is not without any worry. Till he reaches that place, he will have some worries. So be focused. Utilize your time properly. Don't waste your time. Be competent. So complete in your life that way. Yeah, you ask.
First of all, thank you so much, ma'am, for your exemplary address. It was a delight to hear about Chancellor to Alumni Connect from the recipient of International Rising Star of the Year 2018. Ma'am, your knowledge in medical science is known. You've written books on sonology. So, ma'am, my question is related to health statistics. Ma'am, could you please guide us on some learnings from your diverse experience as to how to improve the health statistics in India and how we can use it as a feeder for data-driven policy making in the age of digital India? Thank you, ma'am.
Yeah, very good question. Actually, when we projected once we wanted, when we were postgraduates, and we wanted to focus on the women health. And there was the statistics which we had, which we could find. The outpatient statistics under 5 disease pattern we wanted to study. So more number of male students, male children were attending, and the statistics showed male children came to the outpatient more. And we found very few number of female students, patients. Then the conclusion, the person who studied the situation, she concluded, so under 5, women, the girl children are healthy. So they are not attending the OP, outpatient department. Most of the outpatient departments are attended by the male children, and the statistics of female children are very low. So she was presenting in a positive way. So one of my professor told, no, in India, they are not bothered about the wellness of the female child. So if a male child, sorry to say this, it is a true statement. And nowadays it could have been changed, but some 25 years back. Why I am telling the data is very important. And they told, no, because they are not bothered about the sickness of the female children. If a male child is mildly sick also, they have the habit of taking the male child to the hospital. But the female children, they are ignored and they are not taken to the hospital, and their seriousness is not taken seriously. So then only we thought, okay, then that statistics, which is, we cannot rely on that only statistics. So there is some social commitment under the statistics also. So we cannot blindly say, oh, statistics is that. So we can come to a conclusion. So we always, particularly in the medical field, for example, they will have some 100 to 200 samples, and they will tell, no, this drug is without any allergy or something. When we go, the statistics with more and more people, the setup may be different, and the pattern of disease may be different with different women, different age group, and race, nationality. So it needs much focus. So when we have some statistics, our mind also should think some of the social aspects and some of the reality, and this all things should be having, particularly during the when we study about medicine. And even when we saw about, I always say in a lighter sense, when we were medical students, even now anemia is very much prevalent in India. Not only India, all over the world, 65% women are anemic. In India, 70% women are anemic. So when we used to give the iron tablet to them, they write, okay, this person came and 60% we are provided with iron tablets. So we are focusing on the women with iron tablets. So the statistics as such will say, okay, 100 women came to OP, 60%, 60 of them were diagnosed anemia, and they were given iron tablets, so their problem has been dealt properly. But when we used to go at the backyard, we used to pick up the iron tablets thrown in the ground. So we used to call them and ask, why you have thrown the iron tablets? They used to tell, no, this is very much black in color. So we want a fair baby. If you take the iron tablets which is dark in color, our babies also will be dark in color. So we are not taking. So in a lighter sense, in a pharmacy conference I told, please produce iron capsules in multicolor. Don't produce it in black in color. Multicolor means women always love color, so they like sarees, so multicolor. So why just statistics we would have deceived us. So always the practical thing, and particularly in the medicine, we will be deceived only to see the statistics. We don't see the sociology and social setup and the mindset of the people. So we always, that wider perspective should be there, particularly when we study about medical field.
Thank you.
Good evening to the Governor of Telangana and Lieutenant Governor of Puducherry, all the Rajbhavan staff, and Dr. C.R. Rao Institute faculty. Ma'am, I am Nitesh Kumar Mishra from 2021 batch of Indian Statistical Service, and in my opinion, as you told us you are a gynecologist, I don't think there is any other person who will be able to answer this question in a better manner. So ma'am, my question is that, as you know that every month females go through their menstrual cycle, so should there be any provision in offices to give them paid leave or at least an opportunity to let them work from home during their period days? As a woman and as a gynecologist, what is your opinion on it, ma'am? Thank you.
It's a very good question. I will be popular if I tell yes, but I won't tell yes. I won't tell yes. Because I always feel these 3 days, it is not for rest, actually to doing the best. And I'll be very popular, okay, 3 days you give leave. But our body physiology in such a manner, definitely why in the olden days, chances of infection are more during those days. So cleanliness was not there, immunity will be low at that time. So we should be laud our ancestors for the habits, for the tradition. During those times, the nutrition they were giving was much better than the nutrition which we are taking. For example, during the menarche, they used to give some green grains, and they used to have Bengal grains. They put it in like porridge they used to give, and they used to break the egg, and they used to take it raw. I don't know, in some of the places in Tamil Nadu, we have the habit. They have to break the egg and they will ask them to swallow and fill the egg with Mallanik, what do you say? Sesame oil. Sesame oil. They fill it with that sesame oil and then ask her to take. So I used to think, because they need fat, they need protein, and they need all the minerals. These 3 things all have everything. So, but in spite of giving everything, at that time that extra nutrition and advancement in the society is not there. So they feel very weak, and the chances of infection are more. And because of that, they were given separate place, because even in the villages, you see 3 days. It is not that they should not touch, they should not come inside. If you tell like that, only the society will accept. The society won't accept. So it is almost giving her positive approach by doing that. I mean, during advancement, we are able to do our work. So at that time, when we are competent enough to do things, when we are nutrition and we are maintenance of our body is very good, and our women adopt the work for work. But only one thing I always think: women in army, women in police, and women in security. Personally, and not as a governor, personally as a gynecologist, I used to think women can be more doctors, more staff nurses, and it's not empowerment. Their body warriors are there. But whether army officers should be more in women, or doctors or staff nurses should be more, I will prefer them to be in this profession. Because the sturdiness activity during the menstruation, it is little difficult for them. Because there is a hormonal changes, activity, blood flow, these all things. So when there is sturdiness profession, it can be given. But moderate profession when they sit and work, only brain work is there, that's not needed. So it may be, it cannot be general, but it can be according to the profession or according to the practice or according to the branch which they are working. That can be.
With this, Honorable Governor has other engagements, so we'll close this with the permission of Honorable Governor. Raj Bhavan wishes all the probationers all the best in their future assignments, and Raj Bhavan also thank.
You wanted to ask something? Nothing. Okay.
Raj Bhavan thank C.R. Rao Advanced Institute for bringing all those probationers, to Raj Bhavan. With this, the program is concluded. Now I request all of you to raise for national anthem.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड़ उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जल